Before we go ahead, just want to let you guys know that if possible, please come ahead. I know you guys have come ahead already, but in case if you feel that you're not able to understand or hear properly, you can come ahead. So quickly starting with the session. So just to let you all know that I am Tusha from Student Wellness Center. I warmly welcome you for the session to our panel discussion series, Through the Lens. The series is about expecting important mental and emotional health related topics from multiple perspectives. And today's focus is on hormones, modes and myths. Thank you all for being here with us. It means a lot to us, to be honest. And just let me take a moment to introduce who we are. So just introducing the Student Wellness Center. I hope you all know about Student Wellness Center. How many of you all are aware about it? I am assuming most of you all, and that's a great thing to hear. So I'm quickly just going to give you all a brief about Student Wellness Center at IIT Bombay. It is a dedicated space for supporting emotional, mental and social well-being of students. We work through counseling, outreach and peer-led connects, and to build a campus where every student feels acknowledged, supported and empowered. Our office is located on the third floor of the main building, above the academic section. So if you guys ever want to reach out, you guys can always come to the section, third floor of the main building, and you'll find us there. But before we begin, let me share a little about today's theme, that is hormones, moods and myths. When we talk about hormones, we are often blaming it, that our mood swings are there and we just don't understand what's going on with us. And there are impulsive decisions that we keep on taking every now and then, but the reality is far more nuanced. So through this discussion, we hopefully get to gently unpack some common myths, understand what's actually happening in our bodies and minds, and create space for more informed, compassionate conversations about mental health and emotional well-being. To guide us further with their expertise, we have 3 panel discussions that are going to happen, and the name of them are Dr. Charmi Gandhi, Dr. Rachana Kaveri and Ms. Mrunmayee Pathare. So I'm quickly going to introduce each one of them in brief. So Dr. Charmi Gandhi is highly accomplished endocrinologist trained at premier institutions. She has received multiple awards for academic excellence in medicine and endocrinology. She specializes in managing a wide range of hormonal conditions. Her approach combines evidence-based care with compassion and personalization. She is committed to patient education and long-term lifestyle-based health. So thank you so much for coming, Charmi, Dr. Charmi. Moving ahead, Dr. Rachana Kaveri. So I just quickly introduce you to her. She is an obstetrician, gynecologist, laparoscopic surgeon and fertility specialist. She is passionate about helping women understand, trust and take charge of their bodies. Trained at Pathare Institute of Medical Sciences and Holy Family Hospital, Bandra, she combines clinical expertise with a modern patient-first approach. And thank you so much, Dr. Rachana, for being here. Can we have a round of applause for them? Yeah. And moving to our last panelist, Mrunmayee Pathare. She is the founder of Compassionate Curiosity India and a trauma-informed, queer-affirmative psychotherapist. They specialize in prenatal mental health and work with individuals, communities, and organizations. Their practice is rooted in narrative therapy, helping people move beyond problem stories. Their mental health advocacy has been recognized by WHO's FIGHTS community and Lok Satta. And finally, thank you all for being here. It means a lot to us. So we will be moving forward with the panel discussion, and I invite you, Rahul. I invite Rahul to facilitate further.
Alright, so before we move on to the main event, the panel discussion, I would just want our speakers to come and give their initial remarks on the topic that they will be having. Can we move to the next slide? Yeah, so can I invite Dr. Charmi to give her initial remarks?
Good evening, everyone. So, I'm Dr. Charmi Gandhi. Thank you so much for the kind introduction and thank you so much for the invitation, like everyone, Ankita, Rahul, Tusha. So, I finished endocrinology last year from AIMS Jodhpur and I'm currently practicing as assistant professor at Nayar Hospital, and I also practice at Dadar and Bandra locations. So basically endocrinology is a field that deals with hormones. So these are all the collection of glands which are present in our human body. So you could consider them as sophisticated biological machines which act together, and they help in various parts like sleep, metabolism, digestion, and our day-to-day activities. So basically all these hormones, they regulate our entire system within the human body. And all of these organs, they are connected to each other via like wires. So basically in our medical terms we call them as blood vessels. So hormones are basically chemical messengers that carry information from one place to another. So all of these hormones, they are controlled by the main gland, which is the pituitary gland. So pituitary gland is present in our brain, and that is like the admin of all these hormones. So pituitary gland sends instructions to all these hormones via blood vessels, and then they carry all these information to different organs. So hormones, they are present, they are like small data packs, they are present everywhere, but where they act depends on where the antenna is. So antenna in medical terms is, I would say, it's a receptor. So basically all these hormones, they are acting at a particular place which are nothing but the receptors. So all of these hormones, they are present everywhere in our whole body, but they act at a particular place where there is a receptor for that hormone. So I would like to, as a doctor, so when should you visit an endocrinologist? So basically I deal with conditions like diabetes, thyroid, obesity, cholesterol issues, then osteoporosis or weak bones, or in adolescent health, even PCOS, or if there is excess of facial hair, or if there is some pubertal problems like early puberty or late puberty, or if there is delay in the presence of beard or mustache in case of boys, or if there is some irregular periods in case of girls, that's when you should see an endocrinologist. And apart from that, like anyone who has young onset high blood pressure or any cholesterol issues, obesity, thyroid, all of these problems, you should consult an endocrinologist for these problems. Thank you.
Can I invite Dr. Rachana to give her initial remarks?
Hi, good evening. Thank you so much for having us here. It's a great honor. Thank you so much, and it's also a great effort on your part coordinating for so many days. It's not an easy job, so kudos on that. Can I have a hand mic?
Yeah.
Hello. Hello. You hear me?
Yes.
Yeah. So I'm a gynecologist. I practice in Pathare. I'm quite nearby, and I do have a lot of people coming from IIT Bombay with multiple queries related to periods. So I thought, what can I do to speak about how hormones, your mood, and your period are interlinked? That is very much a part of my interest, and how I like to look upon how women respond to different interactions with people or their stressors in context to their periods. So today let's try and understand about a woman's body, of the phases of the period she is in. Has anybody ever really felt that they have been, they have been challenged, or they have had some experience where they thought they would respond slightly more than what they had anticipated or what the problem was? Has anybody ever experienced that at any point of their life? Yes? Yes. So basically, let's try and understand how these hormones affect our emotions and eventually our periods. So typically we have 4 cycles in our period or our menstrual cycle. The first one is menstrual period. It usually lasts anywhere between 2 to 5 days or 7 days even, and that's where usually the hormone hits rock bottom. There are almost no hormones in the body, and that's usually one of the phases where women feel very, very low. They are bleeding, they are having discomfort, pain, cramps, multiple uncomfortable things that they are going through. Emotionally, they are usually feeling very tired. The mood is very less. They're usually quite self-constrained, not wanting to interact that much. So basically this is the shedding of the lining that we experience in our periods. Now the second phase is the follicular phase, which is usually the happy phase of the menstrual cycle. Here all the good hormones start to rise, our estrogens, progesterone, LH, FSH, all these hormones which are responsible for all the hormones which cause good mood, like our serotonin, dopamine, everything gets a push. So which is why follicular phase, there is increased energy, creativity, the women feels more positive, motivated. This is usually where the the startup ideas in women entrepreneurs usually start. It is a follicular phase which they experience this. Now ovulation phase is usually a phase which for 1.5 to 2 days in a cycle where they ovulate. That's usually for a 28-30 day cycle, the 14th day of the cycle when they ovulate. A lot of women experience increased confidence, they have higher libido at that time. They typically are more interactive and more social during this time. And then comes the luteal phase, which is typically a very notorious phase. The initial parts of luteal phase are quite okay, where the woman, because of high progesterone, feels a little cozy, a little nested, a little more pensive compared to her previous part of the cycle. But then comes the late luteal phase when the PMS hits, and that's one of the most notorious phases. I think we all know, either have had experienced PMS or I know somebody who has experienced very bad PMSs, wherein the mood is extremely low, there is a lot of irritability, they respond and became very, very snappy to a lot of things, and that's got to do with low hormones. They experience physically, they're experiencing bloating, tenderness, and many uncomfortable feelings. So understanding this entire period and sort of if you once you know this and you look back at the times that you have felt very happy or responded in a positive manner, the times that you have probably cracked a meeting or you've cracked something that you really wanted to, versus for a phase where you have done everything right but still not had that proper outcome, everything sort of falls into perspectives, and that also makes us understand how big and how powerful hormones are in women and how we should not take them granted. We have a lot of patients who come to us for postponing periods and preponing periods left, right and center, but understanding how important, powerful they are and how not to mess around with them is a very important thing. So I think that's the only lesson I would like to give out here. Thank you so much.
May I now invite Mrunmayee to give her initial remarks?
Hello. Hi, can you all hear me? So, we spoke so much about hormones so far, right? What I'm going to talk about as a therapist is how hormones are linked to our mental health. Have we ever heard somebody else say that, or have we said this at some point in our life, that are you being too hormonal, too sensitive, or are you PMSing? If this is something that you have heard or said, you know which gender this might get sometimes directed to, right? The menstruators. But if I had to share something, this is going to be the news, right? All of us have the same hormones. People who are assigned male at birth also have estrogen and progesterone, and vice versa. Even people who are assigned female at birth also have testosterone. So what differs is the cycle that we are looking at. What I think Dr. Rachana also said is monthly cycles are different for menstruators, whereas for those who are those who may rank higher in the testosterone, which are non-menstruators, might have daily cycles. This is where we differ a lot. Also, levels are different, right? But if I had to speak about something, how do the hormones actually impact our neurotransmitters? Now, when we are talking about hormones are completely different, right? I think Dr. Charmi was talking about how they are secreted by different glands altogether. How hormones affect mental health depends on how they are interacting with the neurotransmitters in our brain, which has to do with the neurons and the chemical signals that they are sending to each other, right? For example, estrogen and progesterone, they have all these functions which I'm not going into. But how do they affect the mood? If there is anything that goes up and down, just like that first thing that has gone up, there are going to be mood swings, anxiety, depression, PMDD. Have you all heard PMS? Premenstrual syndrome or symptoms. PMDD is premenstrual dysphoric disorder, which is a much more severe version of that. And there is a lot of recent research, active research that is going on there, where there are a lot of severe anxiety, depression, volatility that comes with the emotions, and it is very extreme than what the media might show us right now. Testosterone, if there is any up and down here, specifically down, people can experience low energy, low mood, low motivation, self-esteem, and reduced libido, even reduced sex drive as well. Thyroid, this is something that people link so closely to physical health, right? But even with mental health, it is related to restlessness, nervousness, fatigue, depression, changes in weight, which can also impact your body image. Cortisol, which is commonly known as the stress hormone in our body, is linked to chronic stress, anxiety, irritability, bloating. So inflammation, as you can see, the function is to actually manage the anti-inflammation systems in our body. But if we are very stressed, this leads to a lot of bloating, a lot of inflammation, which can result in disruption in all our bodily functions, including sleep, hunger, sex, etc. What do we need? We need a healthy amount of dose. Dopamine, oxytocin, serotonin, and endorphins. Dopamine, if anybody's heard about it, this is a reward chemical in our brain. Oxytocin is a love and connection hormone. Serotonin is a mood stabilizer, mostly implicated in depression, mania, as well as anxiety. Endorphins, natural painkillers or pain relievers in our body. How do we get our daily dose? These are the neurotransmitters that are going to make us feel happy, that are going to make us feel okay in that moment. For dopamine, we can set certain small achievable goals, bite-sized goals. This can also look like you're doing this through to-do lists. Some people who get high while they do the to-do list check marks. This is where the dopamine kicks in. Celebrate tiny wins. Try something new for the sake of it, just to have fun, not to succeed. Maintain a healthy sleep routine. How do we get oxytocin? If it's love hormone, if it's connection hormone, we get that through connection. So we need to step out, we need to meet people, we need to talk to people. Whether you do it online or offline does not matter, but yeah, if you do it offline, it might be a little bit better. Play with pets if you have pets. Engage in gratitude journaling. Practice acts of kindness if you can. Serotonin, get the sunlight exposure. We need vitamin D to boost our serotonin. This is the most easiest way to get the serotonin boost, which we don't. Again, living in the concrete jungle like Mumbai, right? Practice mindfulness. Map out the milestones. See how far you have come. It is going to make you feel a little bit good. Maintain a balanced diet. Spend time in the nature. The nature can do so much magic for our mental health, but and IIT has a really beautiful campus. So if you get to do that, this will be really great. Endorphins. Why are we talking about natural painkillers right now here? Whether this seems like very unrelated, right? But if our body feels good, our mind is also going to feel good. Exercise, even a 10-minute walk is going to elevate your endorphins. Laugh, watch something funny, listen to the music that you love, watch something that you really, really like. Try dancing, stretching, yoga, any basic movement can also release endorphins in your body. Enjoy dark chocolate if you like it, but in moderation. While we are talking about all of this, does it mean that hormones are the only link to our emotions? No. The context is important too. If you are looking at this is a power and privilege wheel. The closer you are to the center of this, the more power, the more privilege we may have. The farther away we go, the less power and privilege we may have, relatively. So, what does it mean? If our hormones are not just linked to the emotions, how are our emotions also arising, right? There is biology, there are genetics, there are hormones, there are neurotransmitters, there are vitamins also, vitamin D, vitamin B12, which are linked to this. Yet, it is also a product of the environment that we have grown up in and the environment that we are part of right now. Your school, your college, your childhood, all of that. Along with that comes the experiences. Any significant life experience that you have had is part of the mental health that you have right now, and you will continue to have if that is something that we are currently not working on. hormones may shape your mood, but they don't define your entire story. If we had to take away something from this, is yes, hormones are linked to moods, but they are not the only causal factor, or that's not the only causality that is related to mental health. Thank you.
Okay, I now invite all the speakers on the panel so that we can proceed with the panel discussion. Alright, so that was a good start. So I want to start this panel discussion by acknowledging something what Mrunmayee just said. When she started her initial remarks, she said, right, that have you heard this term called are you PMSing or I'm just too hormonal? And I'm sure most of us in today's life, we are often using this statement. So my first question is to you, Mrunmayee. How can young adults actually differentiate between everyday mood swings and something that might need deeper attention or support?
That's a really good question. So if we are talking about something that is maybe, let's say, normative and something that will be non-normative, so something that will need like professional attention, it would also mean that it's not just a mood swing, right? Like there is not just a fluctuation for a day or 2 days. If there is a severe change in your mood persistently for 2 weeks or more than 2 weeks, this is something that again like needs more attention, like professional attention. If there are any thoughts of harm towards yourself or somebody else, this is again very extreme. Again, this is not a very normative mood swing, and especially like with the crowd that we have right now, each lifespan developmental stage is going to lead to some kind of hormonal change in our body, right? So we can't escape that. That is going to happen biologically. Yet, what are some of the things that we are doing to sort of navigate that is going to be important. So recognizing that mood fluctuations are okay. We are not saying that mood fluctuations are not okay. But when things lead to something like you are suddenly lacking the interest that you had in the things that you love to do, whether it is work, whether it's study, whether it's something else, it is something that can lead to, like more of a clinical side of the mood swings, which needs like, again, more attention. Or if it's just, lack of social connection also, that you just don't feel like you want to interact with anybody, even for work. Right, you want to isolate yourself a lot more than maybe like what you're used to, then that can also be something that could be a flagged behavior for us to look into that further.
Okay, and sometimes it is also, we see mood in its face value, but we often forget that there may be a chemical signal behind that mood as well. So my question is to Dr. Charmi. Does the endocrine system have any subtle signs of hormonal imbalance that people tend to ignore or normalize? Is there something like that in the endocrinology? And what's that symptom, if there is, that people should never ignore?
So that's an excellent question. So Mrunmayee already spoke about the mental health aspects of the mood changes and low mood and persistent lack of interest in any activity. So if we speak in terms of some diseases, like I already covered in my initial remarks, diseases I deal with a lot of like varied glands produce various other symptoms like thyroid disorders, diabetes, obesity, all of that. So one common symptom which I would say is, have you ever noticed darkening of skin, like behind your neck, darkening of skin or darkening of axilla? So what do you think? Is it dirt or is it poor hygiene? Any of you, like what are your thoughts on it? Exactly. So excellent. So that's a sign of pre-diabetes or insulin resistance or obesity. So many things in our physical aspects which we tend to ignore are, first of all, that darkening of skin behind your neck or darkening of axilla. That's a sign of insulin resistance. Next, I would say belly fat. Belly fat is now normalized. I mean, when you go out, you see everyone with the belly fat, you think that's normal. But that's not normal. That's again a sign of high cortisol, insulin resistance. So all of these physical symptoms requires attention. So this was about insulin resistance and obesity and pre-diabetes. Apart from that also, if women have PCOS, they may have excess of acne or excess of facial hair over upper lip, chin. So all of these are also concerning factors. I mean, it's not just about body shaming and all of that, but these are some of the symptoms or some of the signs which indicate that there is some greater biology going on inside the body, and you should definitely visit a doctor. So one symptom which you should not ignore is anything like any persistent mood disorder, anything which lasts for more than 2 weeks, she already told. So anything basically which is bothering you, which is affecting your day-to-day life, requires addressing that issue. So the one symptom which people should not ignore is this only. I mean, low mood for persistent while, or maybe increase in weight for a long duration of time, or anything which is not normal. I mean, which is not affecting, which is affecting their day-to-day life. That definitely requires address.
Okay. After listening to you, I think I have high cortisol, but I will get it checked later. So I also, Dr. Rachana, in your initial remarks, you were talking about various phases of period cycle. So that's quite interesting, and I want to ask something on that. We see in a female's life, whether it is PMS or menopause, women often experience multiple hormonal transitions. And what do you think? Which phase do you think is the most misunderstood, and why is it most misunderstood?
So as a gynecologist, I'm practically a feminist. So I feel like all phases of women's life are extremely dynamic, challenging, beautiful, so many things. Having said that, one of the most relevant and one of the most common things that we are seeing nowadays is women dealing with PCOD. In fact, today in the morning in my OPD, I had 8 patients. Out of that, six patients are presenting with some form of symptoms of PCOD. So I do think that is one of the very relevant things right now, and something that a lot of young women are dealing with specifically. We have a lot of students coming in with these issues, so there's also a lot of research because of that. So we are now, almost all of us are very much aware about the physical symptoms of PCOD, like facial hair, acne, hair fall, period issues like irregularities, scanty periods. That's an information we've been aware for some time. But what is new, and what a lot of us doctors also got to know quite later on into that research, is that PCOD not only affects us physically but also mentally. So a lot of women come to us saying that they have some kind of mood irregularities, they are low mood, they would be less social because of in some phases of their life, brain fog specifically, or they had low motivation. So that is something that came up in terms of women having PCOD. So the mental impact of PCOD is quite significant, which we are not aware about. A lot of them also, because of these symptoms like facial hair, they have obesity, they have truncal fat. So because of that, they also have body dysmorphia. They feel quite conscious, and that also affects their social interactions. They rather not interact with people, go outside. They also have eating disorders. So it's like a very vicious cycle that they have to deal with. Every aspect just adds to the other and becomes a cycle for them, which they sometimes cannot get out of. So I think that would be one of the discussions. I think there's a lot of talk happening, luckily, both online and offline, and I think that's something that we should keep talking about and raising awareness about.
Okay, so I do have a follow-up for you. So why do you think students, especially, in certain stressful periods like exams, when exams are going on, why do you think students experience these symptoms like fatigue, cramps, or mood swings? I mean, irrespective of what gender they are, what do you think might be the reason behind all of these symptoms that they are experiencing in such stressful situations?
I think Dr. Charmi shared one of the slides on cortisols. Now the bad guy here is the cortisol. High cortisol affects us on many levels, both hormonal and our neurotransmitters also. cortisol increase has impacts both on our periods in terms of females, and it has also on our mood. Now, what cortisol does is that it increases all the hormone to a point that it causes hormonal imbalance, which leads to low mood, which leads to lack of confidence, which leads to low, they are not able to focus and concentrate, which obviously is bothersome for them when they are, you know, in that specific phase where they need to focus, need to study, and need to get stuff done. Another very important and it's an observation that I've made, that cortisols in general increase prostaglandins. Now, prostaglandins are enzyme-like lipids, which both, of course, in male and female, are basically modulating our pain. So wherever there's prostaglandin, there will be pain. So cortisols directly impact prostaglandins and increase the prostaglandin release. So typically, I have students even from IIT Bombay coming to me saying that they have experienced increase of period cramps and PMS symptoms just before their exam. So when we speak to them and we actually get onto the history, we realize that this is a phase that they have their exams or some kind of submissions that they have, which has led to this. So cortisols definitely affect prostaglandins. In terms of mood, what they do is they reduce serotonins, which are the happy hormones. They reduce endorphins, which are again the happy hormones, and they alter GABA pathway. All of this leads to low mood and sometimes even clinically depression. So which is why cortisol is the reason, and we need to tackle cortisol essentially to get to the base of this.
So it's not the exams we need to tackle, it's cortisol.
Absolutely, yes.
So I can see that stress is a very central concept when I hear your answers to the questions, and that makes me think there are a lot of myths and misconceptions also going around regarding stress. So my question is to Mrunmayee again. What do you think are some common myths around emotions and mood that changes how people are seeing stress, and what do you think young people are internalizing these myths to?
That's a really good question. I was just thinking, like when you said that how a lot of this is linked to stress, there are a lot of people who come to us like for therapy, for a lot of other things also. Young people, right? Who are so aware of what they need to do. They get their blood work done, they have the preventive health checkup, they go to gym, they're having like the balanced diet that all of us are sort of talking about right now. Yet, there is something that doesn't shift. Right? It could be seen physically, it could be seen emotionally as well. Sometimes it could be people who are trying to lose weight are not able to lose weight despite trying everything. Yet, one of the key aspects that they might be missing is stress. No matter how much you follow the diet, no matter how much you're exercising in the gym, there is something that is so closely linked to this, is if you're stressed, a lot of this is not going to have the kind of impact that you want to have on your life. Right? So even if you're making these lifestyle changes, there needs to be some kind of stress management or navigation. Think about like what are some of the things that we actually do to manage stress, right? If I ask you this question, like can I get a couple of answers? Maybe what do we do if we are stressed? Eat? Eat biryani, okay.
Or long walks.
Long walks, yes, endorphins, like we were talking about, okay.
Trying to smile with eyebrows raised.
Oh, wow. Yeah, that is also, by the way, called as facial feedback hypothesis, that if you move your facial muscles to make yourself look happy, sometimes you start feeling happy, even if that is not the original emotion that you started with. So yeah, that can help also.
Listening to music.
Yes, listening to music also, yes. One of those routines that we saw.
Watching favorite comedy movies.
Yes, absolutely. Watching favorite comedy movies, right? A lot of this that we are describing right now and what I had put up on the slide also is something that definitely works when you're not carrying a lot of personal baggage, right? If we are carrying emotional baggage from somewhere, it does impact our stress. If you have any unresolved childhood trauma or feelings towards significant figures in your life, this is going to add to the hormonal imbalance that you may have. When I'm talking about when people say that, oh, I got my blood work done, everything is okay, everything is within the range that it is supposed to be in, there is a missing part. Nobody is getting any of the hormones tested. A lot of the CBC and you can add to this, a lot of the criteria that we have there are linked to a lot of physical symptoms, but not so much emotional, right? There are certain things, right? We don't think about vitamin D or like B12, omega-3 fatty acids being so closely linked to mood also, but they are. There are tests for that, and now there is increasing awareness that we need to get tested for that as well. This is again not to say that only getting done like your all the hormone related work also done will not let you get sad or something like that. Yes, all of us are going to feel low at some point in our life, and that is okay. How we get back to maybe the baseline, I'm not even saying we need to feel happy to counter the sadness that we are experiencing, right? How do we get to something that feels okay enough for us to sit with that emotion right now is going to be the key. For that, we need to also learn more than like the kind of things that we have described right now as strategies to deal with the stress that we are carrying. And some of them could also be that we are reaching out for professional support, right? Not everybody needs professional support, but if you feel like even if I have a lot of friends, even if I have greatest connections with the people in my family, there are still some things that are not really like shareable with some of these people, because I don't think they would understand exactly what I'm saying. And even if they do understand that, I don't know if they would be able to hold that space for me. Please seek the support. I think you have a really good, amazing student wellness committee here, which is doing a lot of things, and I do know that they do have like a lot of counselors also here, so please reach out to them as well if you're going through something. So yeah, I think one of the myths that I would like to debunk is that hormones again like are linked to emotions, but they are not the only ones which are like impacting the emotions in some way. It's also the environment and your experiences.
Okay, interesting. So when you say environments, it makes me think regarding something related on our lifestyle as well, because our lifestyle is heavily connected with our environment. So Dr. Charmi, my question is to you. Do you think can lifestyle factors like sleep, diet can significantly impact our hormonal imbalance in some sort of way?
Yeah, so Mrunmayee and Dr. Rachana already simplified my job here, but like just a quick show of hands. So how many of you sleep less than 6 hours here? Yeah, I can see a few hands up there. So, see, definitely sleep, stress, all of these affects our hormones. In a way, we cannot even, quantify that. So again, like if we are sleep deprived for a long period of time, it increases your cortisol levels, it causes insulin resistance. So that's what when she mentioned that I'm doing everything right, but still I cannot lose weight. So diet, exercise, all of that are one thing, but if all 4 of them work together, like proper diet, good exercise, sleep, like proper well-maintained sleep pattern, and stress. So all 4 of this, if we work on it, then only there is some results which we can see appreciably. So stress, obviously it increases cortisol levels. At the brain level also, it causes dementia, and there is increased risk, increased forgetfulness and all of that. Apart from that, it also affects your heart. It leads to increased blood pressure, it leads to increased cholesterol levels over the time. And again, obviously obesity has its own impact, like snoring at night time. All of these factors are related to your stress, sleep and lifestyle. So I would say, even if many people, they come to me and they say like they sleep at 7 a.m. and they get up at 3 p.m. They say, but doctor, I am having 8 hours sleep. That is not important. Important is circadian rhythm. Circadian rhythm meaning sleeping at night time and waking up in the morning. So just 8 hours is not sufficient. 7 to 9 hours is the recommended ideal sleep period, which is good for better hormonal health. So this 7 to 9 hours has to be at the night time, not during the daytime. So altered circadian rhythm also affects your health. During exam times and during stressful times, that's still okay. Even then, you should probably have a habit of sleeping well on time. Exams will come and go, right? But your health, that is the most expensive thing which you have. Exams and stress, all of this are part and parcel of life. So I would say 7 to 9 hours sleep. Avoiding your phones 1 hour before bedtime. That is all the part of sleep hygiene. So again, this scrolling mindlessly, that causes blue rays, blue light, which affects your eyes, UV rays. All of these have impact on your health and eventually your hormones. So 7 to 9 hours of sleep at the night time and proper diet. So how should your healthy plate should look like? So the plate should have over 1/2 of the plate, it should be filled with vegetables, and 1/4 only either roti or rice, not both. And rest 1/4 should have some source of protein. So if you are like non-vegetarian, you could have some meat or eggs. If you are vegetarian, you could have lentils, dal, paneer, tofu. All of those are good protein sources. So good diet, good lifestyle, better stress management and exercise. All of this, if combined together, then only your hormonal health would be much better when all of that, when you see in a single.
Again, after listening to you, I've realized my circadian rhythm is also not good. So, Dr. Charmi, you are making me realize so many things. I have a follow-up for you. You are talking about diet and lifestyle, and we have, over the past so many years, we have also seen that there is a very increased focus on gym culture, especially high protein diets. And there is a lot of awareness, a lot of information going on high protein diets. How do you think protein intake and exercise influence our hormonal health especially? And are there any risks associated with overdoing it?
Right. So are there any gym freaks here? Okay, so are you taking any protein supplement? Right. So see, protein definitely now there's a lot of hype around protein, and I'm glad that is spreading among youngsters of today's world. So protein, how much, 1 to 1.2 gram per kg is the recommended protein intake ideally for a normal person. If they are in a very heavy strength training exercise, then up to 1.5 to 1.8 gram per kg of protein is required. So the basic idea is to consume all of that protein through your natural diet, through your sources which you have. But vegetarian diet, that is already protein deficient, so you don't have a lot of if you're not able to finish your protein sources requirement through natural diet, then I would suggest you to go for supplements. But again, supplements, why supplements are bad now, because there are a lot of artificial sweetness inside that, lot of filling agents, anti-caking agents, and basically the protein component would only be some 40 to 50% out of 100 gram, which is very low, and other rest of the things are all kachra which they are adding inside, which you do not require, and basically which is harming you. So 1 gram per kg protein requirement should be met ideally through natural sources, through your food, because food does not have only protein. Food has lot of other micronutrients as well, which are essential for your body, like vitamins, minerals and all. But protein powder will have only protein, so other nutrients are also equally important. So yes, gym is important. Gym as in strength training, any kind of strength training you do. So for youngsters, gym, and for elderly people, maybe resistance band or anything they can use, because muscle mass is very important. As we age, we tend to lose our muscle mass every year. So to preserve muscle mass, definitely some kind of strength training has to be incorporated in your daily life. And see, there are two basic types of exercises. One is strength training and one is cardio. So cardio is basically aerobic exercise. So those that could be done by 7,000 steps per day or 10,000 steps per day. So walking, jogging, swimming, all these are kind of aerobic exercises, and both are required. Only gym does not work. Only aerobic does not work. For a healthy life, combination of both strength training as well as aerobic exercises are important. Gym is not important. Strength training is important. You can do at home, you can do at gym, anywhere. And protein, please do not overdo. Do not, increase beyond 1.5 gram per day, because that excess of protein is going to harm your kidneys. Kidneys have to put that excess of load to filter those extra protein in your from your system, right? So 1 to 1.5 gram is the recommended protein intake. And apart from that, please do not consume any kind of supplements or testosterone injections that gym guy is recommending me. I have a lot of young patients coming in that gym guy gave me testosterone injection. So please kindly refrain from using all of that. So from supplements, protein is essential, and exercise, that's it. So I would say that from my side.
So I guess the guy who likes to eat biryani, including me, doesn't need to go to gym. He's getting his protein. Anyways, but I am someone. When I go and work out, I feel I am not overdoing it. But still, sometimes I feel that I am also getting mood swings. I am also feeling a little irritable or moody on a particular day. But Dr. Rachana, my question is to you: how do we deal with these symptoms like mood swings, irritation, even if we are not doing anything overly in our lifestyle? Still, sometimes we experience it. And when it comes to females, they experience a lot of menstrual cramps as well when they are feeling a little bit stressed. So, in a healthy, sustainable way, what do you think we can do to deal with these symptoms?
I think a very relevant question, Rahul, because I think you all have your exams coming. I mean, the students have their exams coming up, which is what you said, which is why a lot of them are preparing, I believe. So we spoke about stress, we spoke about hormones. I'm going to be a little biased and speak more about women, but I will just add a little bit something that all of us can do. So my first point would be probably to deal with our stress or to deal with mental issues related to this. In case of women, what we need to do is we need to track our cycles. That's, I think, one of the most easy and a very definable way to understand what is happening in terms of our biology, hormones and everything. So tracking our hormones, understanding where there is where we experience mood swings, when we have particular symptoms, whether it is in the luteal phase, late luteal phase, menstrual phase, it definitely gives us an understanding and a touch about how we can deal with them. Another thing that we should all be doing is, like Dr. Charmi correctly said, sleeping. It's a non-negotiable, guys. 6 to 8 hours of sleep. There's also, she of course discussed about circadian rhythm. But another very, very important thing, melatonin. Melatonin is released only and only during sleep and sleep at night. And another very important thing that I always tell my children, you always switch off your lights when you're sleeping. Now the darkness is where the melatonin gets released. Melatonin is a repair hormone. It repairs our body, it repairs our mind. It's a very, very important hormone if you're dealing with stress, if you're dealing with anything. If we don't have those good minimum 6 hours of uninterrupted sleep, we're definitely not gaining back that repair from our sleep. So sleep, tracking your periods. Another thing is our diet. We discussed about proteins and everything. What is very important in our day-to-day life is probably complex carbohydrates and a good combination of proteins. There's too many discussions about whey protein and plant-based protein where we tend to forget what our actual sources of proteins and carbohydrates is. Even Kasap, when he shot down Mumbai, he carried a lot of dry fruits in his, his pants, small sachets of dry fruits. Why? It's a source of energy and it's a sustained source of energy. So if you're going to have something which peaks our sugar, which peaks our energy, and then there's a crash, we're going to have a low mood. We are going to most definitely fail in our attempt to maintain good mood, good outcomes and everything. So typically dry fruits are all proteins and complex carbohydrates. So they figured it out. We just have to implement it. We are just busy searching protein sources all over the internet. So that is, I think, the third point I would like to say. Fourth would be definitely that, identifying problems, like especially in women, if there are, I have a lot of patients who have hesitations taking hormonal tablets, who have hesitations taking a single pill for extreme pain that they're experiencing. They're usually very stressed that if typically they're going to get their periods during the exams, they're extremely stressed to an extent that they feel that they would probably not do well in this particular exam because it's coinciding with their periods. And even then, they are not willing to take a single pill, which I do understand. We should not be popping unnecessary pills. But just imagine this, a woman is going through 420 menstrual cycles through her life. 420 cycles, assuming even the first day is the only painful day, she's experiencing extreme pain, extreme cramps, low mood, bloating, depression, anxiety, irritability for 420 days in her life, and she is refusing to take a tablet just because some auntie said so, internet says so, some random influencer says so. But a gynecologist who's read about this, yes, there are side effects, we are not justifying medicines, but one tablet under a guided way would not do any harm. So one is take treatment if you require, if you're experiencing depression, low mood, even for men, there is not a lot of talk, unfortunately. There's too much normalizing about being a man, which we are all been doing it. I think everybody needs a soft place to land, both men and women. Women in terms of easing their periods, men in terms of being able to address their mental issues, being able to go to a counselor. I'm so happy to see, I was asking Rahul whether most of the registrations are women or men. I'm just so happy to see so many men out here trying to understand all of this. So that is the other thing. And then there is tackling with the cortisol. How do we tackle cortisol level? I think this is relevant to all of us. Very simple 101s. I think when I would say it seems obvious, but on day-to-day basis we probably don't do it. something called as a Pomodoro technique, wherein you take 25 minutes, you do whatever intensive anything. You do intensive exercise, you do intensive studies, you do intensive. I did an intensive yesterday night, thanks to Rahul, an intensive 25 minutes presentation making. But I did take 5 minutes break, because without that, I know that my next 25 minutes is not going to be as effective. So a 25 minutes, whatever intensive studies you want to do, and a 5 minutes deliberate break. Put a timer. You set yourself up for 25 minutes. Finish whatever you want to do. You can do big bouts of. Let's say you're dealing with a topic, especially for students. If it's a big topic, try to tackle it in 25 minutes. Once your alarm rings, shut the book. Take 5 minutes. Go out for a walk. Do something and sort of divert yourself. 5 minutes later, come back. You'll have come back with lower cortisols. Another thing which a lot of us do, and sometimes we sort of underestimate, is morning meditation, which is also very, very important to beat cortisols. These are small, very tried, tested methods, and because they are not marketed very well online and on Instagram, we really fail to understand how effective they are. And the last but not the least is understanding warning signs as to when to come to respective doctors and counselors at your center. You have, I think, 19 counselors. It's mind-blowing how much how much aid we have and how much we refuse to take it. So probably understanding the warning signs and then approaching counselors or doctors based on whatever it is we are tackling is probably, I think, something that we should accept and do for ourselves.
Alright, interesting. I have a last question to Mrunmayee. After listening to all three of you, I realized that we have so much awareness on hormones which is going on, and it's actually good for us. But it also makes me think that sometimes, don't you think ignorance is a bliss? Does knowing so much about our hormones is it required? Will it actually empower us? Or do you think, it's okay, we don't need to know too much about it?
Wow, that's a good question. I'm just thinking about the counter to that is how awareness does not mean insight, and that does not mean change also. I'll explain. Just because we are talking about hormones, moods, myths, all of that does not mean that we are going to go from here after the talk is done and suddenly transform our life with something, which also means that although there is awareness, we are raising awareness, all three of us, and also the SWC team is here because we want to raise awareness about hormones and mood. Yet, what we are expecting you to take back is little insights, right? Does that mean it will need to change? Is a really big question. Yet, why are we here? We are here because we want to also give you the language of describing what is happening to you or maybe somebody who's close to you, right? A lot of the times when we don't have the language, when we don't know how we are going to describe our experiences, it can get very vague, right? For example, PMS, PMDD, a lot of these terms, PCOD is something that, do we think is something that people are going through right now in the last 10 years or 20 years? No, there were a lot of menstruators before this also going through something like this, but they did not have the vocabulary because the research was not targeting that maybe, or there was not collective census on, or rather something that they would say that this is a cluster of symptoms or this is a cluster of experiences that we want to name so and so, right? If right now we have the language, why not use it? If we have the language right now, why not also try to verbalize the experiences that will also get us the help? If we are not able to describe what is happening to us, whether it's related to hormones, physical health, our mental health, it becomes difficult for the other person to also give us customized help, right? That does not mean that you need vocab for every single thing. Right now also when I'm talking, I'm using a lot of non-verbals, right? My hand gestures are quite a lot. This itself can also be a way of communication, but that does not mean that it is leading to overthinking, right? A lot of the times when we are thinking about when to differentiate between whether awareness can lead to empowerment or whether awareness about anything, not just hormones, can lead to overthinking is if you're just sitting and thinking about whatever we are talking about today right now and not doing anything and just still thinking about it even after days and weeks and months, it might be overthinking. But if you actually go and make a small little change, like we spoke about so many things today, right? From diet to exercise to like the dose, a lot of little things like meditation. One of the things that we can do literally right now as we are hearing about all of this, and I think everybody's looking forward to also like wind down the day eventually, is to take one deep breath. Even that itself can make a lot of difference, right? One deep breath is not going to change your world, but if you continue doing that, what it will do is soften your nervous system. How do we know this? Because we have language for what does it mean to feel overwhelmed, what does it mean to feel maybe I'm experiencing brain fog, I'm experiencing confusion. A lot of these words are also language, right, that are describing our experiences. This is where like the differentiation between like the awareness does not necessarily need to lead to overthinking, but it can be empowering. You will know who to reach out to based on how you're describing the symptoms. Again, this is not to say that, again, when you have seen and heard us for I think last almost half an hour or more than that, you will realize that we are talking about the same thing but from 3 different perspectives, right? When do you reach out to each one of us or like our professionals is something that will depend on what kind of language you are also using. So if you are only describing something related to mental health, somebody would ask you to see a psychologist or a psychiatrist. If you are saying that there is something related to physical health, the first thing that comes to our mind is also going to a doctor, right? Like that might differ, like gynecologist or endocrinologist, depending on what do you exactly need in that moment. Having said that, if you're noticing anything about your life right now that you feel like, oh, this might be addressed by all 3 of us or the people who are in profession with us, think about if you need holistic support as well, right? There is no one right way to approach your hormones. There is no one right way to only engage with certain kind of diet, certain kind of exercises, certain kind of like mental health hygiene also. So think about what suits you, what is suiting your current lifestyle, what is also suiting your past experiences that you have had, which are informing who you are today, and that intersectional wheel that we saw, the power and privilege wheel. Within that also, again, like the access to reaching out to professionals might be limited, right? In that sense, like when we have the language, if we are able to also get the self-help resources, if we have not reached a stage where we really need professional support, not when you actually need professional support, I'm not speaking about those situations, but if you are able to sort of do that, like get yourself the help because you are able to think about your experiences in a certain way because you have that language accessible to you, that might still help. The other thing that I was also thinking about in terms of like menstrual cycle tracker is for those who are non-menstruating, if you want to also track your cycles, how do you do that, right? Because we know that the testosterone like sort of goes up and down every single day. So how do we track that? The easiest way to do that is to map your energy throughout the day. If you want to do that, let's say from the beginning of your day till you go to sleep, think about like from 1 to 10, 1 being the lowest, 10 being the highest, like what is the level of energy you are carrying like throughout the day. At least for a month, you will recognize what are the patterns that you are carrying in terms of the energy, in terms of like the testosterone levels that you may also have, right? A lot of us have period trackers and like manual ways of also tracking like menstruation, but for non-menstruators, this could also be a thing. How does this become possible, what I'm talking about right now? Because there is language, there is awareness, and that is why we are here, right? So yeah, it can definitely be empowering.
Good. That was a very interesting thing what you said. I mean, just to summarize, too much information is not mainly associated with overthinking. It can be empowering, but there needs to be a balance, right? So I think, that's a wrap for the panel talk that we are having. It was very nice having all the perspectives and all the insights you gave on the topic that we are discussing today. But now I would like to open the floor for question and answers. I am sure that most of the questions are answered in the panel talk. But if still people have any questions, you can raise your hand. We have 2 of our people here who will be coming with you to you. And with respect to the time, we won't take too many questions. Just make sure you are not taking a lot of time giving your question, and only one question per person. Yeah.
Hello. My question is to all three of you. Like, what according to you has changed in the past few years? कि कुछ सालों पहले तक लोगों को उतना ज़्यादा स्ट्रेस नहीं होता था. Maybe we can say that the exams were not there, social media was not there, but कुछ तो था उनके लाइफ में भी स्ट्रेस लेने के लिए. शायद खेती नहीं ठीक से नहीं होती थी. कुछ तो more uncertain life than us. We are living in cities. लेकिन फिर भी हम इस लाइफस्टाइल में स्ट्रेस ज़्यादा है और उनमें कम है. What has changed?
Anyone can answer. Yes.
I think you already like answered your own question a little bit. Is social media, right? Also, the onset of pandemic has changed our lives so much. If you think about it, like just before the pandemic, like life seemed a little bit slower than what we are having right now, no? Not like we were not thinking about, studies or work or where we want to go, like in our life, what kind of milestones we want to achieve. But right now, because during the pandemic, suddenly, like the only thing that we were consuming was social media so much because everybody was stuck at home, that everybody started posting a lot more on social media also. Right now, that has turned into a whole different world altogether. And as you can see, also like so much of doom scrolling that is happening that doesn't allow us to sit with some of the thoughts or reflections that we may otherwise also have, which also leads to a lot of thoughts about where am I at right now, right? When I'm seeing like somebody else maybe like going on multiple international trips in a year, or like somebody disclosing their package like I'm earning these many lakhs or maybe crores also. It is somewhere, even if we think that this is not what I want, it is subconsciously like staying with us, right? That itself can lead to hustle culture. Because we know what is possible, and there are a lot of things that are possible, right, throughout our life. That does not mean that everybody will also get everything, yet it also sort of pushes us to do more. The hustle culture itself is so capitalistic that it runs so much on the fear that I am missing out on something. It doesn't matter like what else you are doing in your life, there is always going to be something more to do. And that itself can lead to that FOMO that we are talking about, that this is something that if I don't do this, I'm going to lag behind. And so I need to keep doing more. And that's why like the lifestyle that we have also built right now, whether you have children or not have children, with children it gets a lot more tougher sometimes. But even if you don't have children, there is just so much to do that it can feel very exhausting. So that itself can again lead to like cortisol levels are high, you don't sleep enough, that is going to like disrupt a lot of other biological functions that we are having, including our gut health. Our gut health is also linked to our mental health, so that is going to get affected. So it's like a vicious cycle that just goes on.
Just to add to that, yes, of course, absolutely correct. Another thing I think in today's time is also a lot related to epigenetics. Genetics, तो हमें पता है that okay, if our parents have diabetes, we'll get diabetes. But what we are now in current generation facing a lot of negative epigenetic impact. Meaning, हमारे खाने में मिलावट है. Most of the times when students come to us and we try to tell them what to eat healthy, I take a second to tell them to eat fruits because I know that the fruits are loaded with pesticides. Now all of this, हमारे खाने में मिलावट है, air is really bad. We all know the impact of air pollution that is going on. So all of this modulates our genes in a way that all the bad qualities that were there in the previous generation, which were luckily because they were more active, were on the background, have now come in the forefront. So what they have already transmitted could have not happened had our epigenetics been good. Our food would be clean. Organic food was truly organic. Organic food in India is not at all organic. So these factors also contribute to our hormones, stress, cortisol, which is leading to these problems. And unfortunately, there's only so much we can do. ये सारी चीजें हमारे control में है ही नहीं, more or less. Like, what can you do? At the max, as a student, you can try and get fruits and eat them from outside. but how can you control the pesticides that are there? How can you control the food colors that go into it? How can you control possibly a sugar infusion that is done in it? That is the issue.
I'd also like to add one thing. Again, rapid delivery systems, Swiggy, Zomato, Blinkit. Like, you don't even go outside. सब कुछ हाथ में मिल रहा है यहाँ पे घर पे आके. So again, all of that, and plus like, whatever food we are eating full time, that's processed only. Lays ले लिया, chips ले लिया, namkeen, kurkure. Anything you're having basically, that's highly processed food, full of maida, full of sugar, full of all bad things. So all of these again influences again air, water, food, everything. So that's why probably the prevalence of lifestyle disorders has been increasing now as compared to before.
Yeah, one question.
I would like to ask about the phases that you have mentioned, the 4 phases. I'm 36 years old, and when I discuss with my friends, we all feel that post 35, these stages are much more profound. You see the ovulation phase, it's like you're going really happy high, and when it comes to the luteal phase, you're deep down in the shit, and it's more profound and you're struggling to come back. It was not like this back in your age. Is it because the age is kind of holding it back, or is it anything to do with the perimenopause phase, or it's a lot of brain fogging? You're not able to do anything on those 2 days. The husband who is Charmi in the ovulation phase is going to be a villain in the luteal phase. And so the cycle is happening every month. Every month this is keeping on happening. So I would like to get the answer from the gynecology perspective and also from the therapist perspective. Thank you.
Kudos to you on declaring your age on a public platform. Good on you, ma'am. So you said it, okay? There is a big switch that happens at 35. I don't know what it is. There's nothing mentioned about this particular 35. And I feel that 35 is the middle-aged woman. This is what I'm saying. Women might live longer. Women do generally, luckily, do live longer, touch wood. But 35 is now the middle age. It's no longer 45, 50, nothing. And a lot of it has to do with our ovarian reserve and our ovarian capacity. What symptoms we were seeing at 42, 45, we are now seeing it at 35, 36 and 37-year-olds. So as our ovarian quality reduces, again because of epigenetics, alcohol consumption, smoking, and sometimes unfortunately not even when you're doing anything, just because of the environment we are in, those hormones reduce. And there's a lot of overlap that is happening in these follicles, the phases. So there's no longer that clear-cut distinction. And also what a lot of women do say is after 35 they started experiencing a lot of fatigue. No matter what they do, no matter how much they sleep, even after an 8-hour sleep, when they get up, they're usually just tired. I myself sometimes feel when I get up that I've been battered, and then I've not slept, I've just been battered and I'm now up suddenly. A lot of that has to do with our muscles. Actually, our muscles are our peripheral heart. And the only way to probably beat it, we can go on discussing as to why it's happening. But one quick thought about what can we do that this is happening is doing a lot of weight training. Our muscles will pump our blood. Our muscles will pull us out of all of this. So if we are really taking care of our muscles, we are usually winning the battle. So probably one way is antioxidant. There's a lot of talk about now longevity. We have a lot of conferences, a lot of discussions about longevity, about how to live a more fulfilling life through this. So I think now we all are very, very clearly know that even one glass, which was typically traditionally said was good, is no longer considered to be good. So alcohol, smoking, all of that reduces longevity, and basically that has to do with oxidative stress in the body. Oxidative stress can be because of all the things that we discussed. Our stress levels, which are unfortunately no longer in our control, because I believe now all of us, can anybody truly raise their hands and say they are not stressed? Can any one person say? I feel like stress is like a baseline. Now we no longer consider this as a different factor. So one is oxidation because of stress, another is oxidation because of products and food which we are not supposed to be eating, and another is because of sedentary lifestyle. So probably to beat this, working on our muscle is, I think, we are also of course reading and doing a lot of research and understanding, but from what I am seeing now in the last 10 years of my practice is this is one of the short ways to reduce these fluctuations that we are seeing in women. So usually I counsel my people who come to me like this, that your 20s are for having a lot of fun, your 30s are for cardio, and your 40s are most definitely for strength training, no doubt about it. Work on your muscles and it'll be very rewarding through your perimenopause and menopause. I'm also trying to do
We have a question there.
Yeah,
Oh.
first of all, thank you to all.
One second. I think you wanted to add.
Yeah, quickly just add to that from a mental health perspective that by that time, like we are in our 30s and 35, it's a developmental milestone, right? We are stepping from like our young adulthood to middle adulthood as well. And yes, like just like gynecology, even in like the field of psychology, we do have like those segregations as well. Apart from that, what happens typically, unless and until you're single, obviously single people do have responsibilities. But if you get into any relationship or get into starting family or get to live with somebody else's family also, suddenly the responsibilities change. The lifestyle also changes. A lot of these also have impact on our mental health. Having said that, by that time, a lot of us have formulated our own opinions as well. So what you were describing as, hey, like the person who started to seem like, hey, this is my like safe space, or you know, somebody that I really, really love, how has that turned into a villain, right? A lot of the times that is also because the honeymoon phase in the relationship starts fading a little bit. It becomes a little bit monotonous. It becomes more like a routine. So it can get into like a little bit of like monotony, and that can lead to a lot of these feelings that we are having. So yes, definitely, like, you know, biologically there are so many things that we can also look at, yet how our relationships develop or evolve over a period of time also contributes to that.
Thank you. First of all, congratulations to all three of you. Nice, effective and informative talk. And just I think I have got the answer, because I was about to ask, nowadays all things having pesticides and adulteration. And I'm observing, I'm 35 plus, so I'm observing everywhere, almost all young girls and women always facing the hormonal problem. And just my question was about that how, what solution we have in our situation, because we can't omit the food or the dairy products or anything. We have to survive eating all these pesticide containing food. So what will be the like solution right now for this situation?
Anyone can answer. I think what she's trying to ask, what can be the immediate relief we can do, we can, you know, utilize to get
I'll take that one because I'm a mom of two and I'm exactly thinking like this every single day. What do I do so that my girls get better nutrition and a better head start to their life? Probably at least as much as when I was younger, when we had clean water, better food, better air. Okay, couple of things. These are of course not foolproof. We know that organic food is just marketed better. It's not better food technically. But what we can do is we need to try to search for sources which are slightly more reliable. Meaning, there are now a lot of milk products. You can actually go to those farms and check whether they are better. Whether or not all of them are marketing, I don't know. But we can definitely find sources where, you know, it's a little more trustworthy. I recently found out that cranberries, which we recommend for urinary infections, have a lot of wax coated on it, and I'm no longer recommending it. So it is getting difficult, but finding trusted sources for this. There is not much in our control, but there are certain things that definitely are. Exercising is one of them. I'm again coming back to that point. Other than that, what we can do is at least we can reduce our consumption of sugar, refined products. When we were children, try and remember the times that we have gone to a bakery and got a pastry, and you know, there was a day like our mom used to give us a pastry once in a month. I used to be a good girl the whole month only for that one pastry. And versus now, my children, there's bakery products all over the house. They have it's, you know, always available. So now what we can do as for ourselves is something I've learned through one of the podcasts, is make it difficult to consume these products. Don't let it be available. Don't download Zepto. Keep it off limits. It's of course easier and it's sometimes very necessary. We have so many, it's useful on so many levels, but try to make getting unhealthy things, unhealthy lifestyle more difficult, and try to make healthier lifestyles slightly easier. If somebody is very addicted to coffee, probably just keep a box full of green tea next to that. If somebody is not really wanting to go out and gym, just keep your shoes and gym clothes out. That reduces decision fatigue, and maybe you'll probably be a little more motivated to do the positive stuff versus if you're just always keeping ice cream in your refrigerator, you're bound to eat those ice creams. But if you don't have it, there's a possibility you will get bored and not order them, or you'll at least be lazy and not order them. So try to make your healthier lifestyle easy and in the flow of your life versus unhealthy things. Try to make it difficult to achieve. That is probably one of the ways that we can start at least.
Yeah, and there are a lot of things like even cosmetics and plastics have endocrine disrupting chemicals. That's why we are seeing a lot of puberty at earlier age, like 10 years and all girls are menstruating. So all of these are definitely not in our control, but you have to minimize the use of processed foods, packet foods, anything that comes in a packet. I mean, there's a lot of YouTube initiatives also to read the label, right? So by like a lot of YouTubers. So make that a habit and just turn the piche ka thing and see what is the first thing written. That is in highest concentration. So refined flour, if anything that has refined word in it, that means it is, very like maida. So try to avoid those things. So yeah, anything that comes in a packet, start from that, avoid that. Whole fruits, whole vegetables, whole grains, try to consume that as much as possible. I mean, even they could be adulterated, but that's like really not in our control now.
Any other questions? Yeah, we have a question.
I'm a student counselor here. So I just want to ask one question. In case of depression, a lot of time it is associated with the thyroid functions. And so when we should look for this, every depressive cases should we look for this, or is there any signs that we should take care?
Yeah, right. So I mean, thyroid. See, there are two types of thyroid disorders. One is hypothyroidism, where your thyroid is less functioning, and one is hyperthyroidism, where it is called as overactive thyroid gland. So both of these are associated with important mood disorders. Like the hypothyroid will cause slowing of everything, slowness of mood, slowness of activity, then increased lethargy, decreased interest in daily activities, life and everything. And hyperthyroidism on the other hand is associated with overactivity, anxiety, tremors, ADHD type of symptoms. So I mean, as an endocrinologist, thyroid disorder should be screened in any person who is having depressive disorders, and then the treatment would depend on, of course, the TSH level and other symptoms. So all depressive patients need to be screened for thyroid hormones, because obviously anything that is organic needs to be ruled out first, and then only we would label that as just because of psychiatry. So organic disorders has to be ruled out in all the conditions, and if thyroid is normal, then only we would refer for further management to a psychiatrist.
I would also add vitamin D and B12 to that, because vitamin D deficiency and B12 deficiency itself, just because of vitamins, it can mimic like the symptoms of depression. You can feel low, you can feel like, oh my god, I don't even want to wake up, or I don't even want to get out of my bed. A lot of these symptoms, even though you are, experiencing like the physical lethargy, it will be accompanied by like loss of interest in the things that you're doing. Again, like you're a counselor, you would know like a lot of the depression symptoms, right? It also mimics that. So along with that, it is also important to get the vitamins checked.
And most severe stage of hypothyroidism, where TSH is very high and thyroid hormones T3, T4 are very low, that is associated with severe depression. Myxedema coma is the term given to those things. So I mean, if the depression is because of the hypothyroid state, then that is correctable one, right? So you would want to do that first and then refer for further psychiatric counseling.
Sometimes general physicians wondering why we are referring depression cases. Like for general evaluation, if we say they are confused, that's why. Yeah.
No, that needs to be evaluated for everyone, like for all patients, all depressive patients.
Yeah. And now PMS, PMDD is very much prevalent. So as an interdisciplinary team, how we should handle this? We have option, we have all the medical facilities here. So how gynecologist, endocrinologist, and the psychotherapist and psychiatrist as an interdisciplinary team, how should involve in this?
So there
There are a couple of questionnaires that we can start off with, wherein to just distinguish whether it's just plain PMS, which is quite manageable with nutrition, even supplements, for example, whereas PMDD, wherein you require counselors, doctors, psychiatrists sometimes, where they have to be started on SSRIs and everything. So there would be questionnaires which the woman who would come to you would be going through, and based on that and the scoring and everything, there should be the distinction that should be made. That is usually the first thing that we would do, is give the questionnaire to the patients. We have some questionnaires available online, and we've also curated some questionnaires in our faculty, wherein we can probably just forward it to you all, where you could give it to all the patients who are coming to you, and then accordingly see whether they need any additional support, or only counseling is the only thing that would require to be done for them.
So I think that's it. Do we have any other questions? Maybe one last question we can take if we want to. Okay. So yeah, I would like to call our host Tushar to give the vote of thanks and wrap up the session.
Yeah. So I know we are quite past our time. So I would request each one of you to just wait for 5-10 minutes more, and we'll be quickly closing this session. First of all, I would like to thank you everyone for being here and being a part of this session of Through the Lens, that is hormones, moods and myths. A special thank you to our distinguished panelists, Mrunmayee, Dr. Charmi and Dr. Rachana. It actually means a lot, to be honest. I've learned a lot through this session today. It actually, there's certain things going on in my mind, like how much our body and mind is connected, and we do not really know much about it. It is something that we know on the shallow levels of it, but they have actually given us insight on the depth, on the deeper level as to what is exactly going on. To be honest, we usually talk about moods and hormones from a female perspective, but to be honest, they have actually told us or reminded us that even men go through it, and it is very important to focus on that as well. So I thank you so much for giving us this beautiful insight and amazing understanding to the topic that we have decided. So I would also like to thank Mr. Rahul for moderating the session so wonderfully with some bits of humor here and there. And yeah, thank you to each member of our SWC team for the constant support that we have in each event that we take and each event that we do. And lastly, thank you to all the participants for being here. Your presence, attention and your thoughtful questions meant a lot to us, and your curiosity and engagement did do a lot of difference, and it led the session to have a very meaningful conversation. Lastly, I would also request you all to give feedbacks and join our WhatsApp group that we have, and we look forward to give you all more information about the events that keep on happening in our team, because there are multiple events at on each month that we have. We have another session coming up on Monday, that is the art of unplugging. And if you wish to register for that, I am sure there will be certain details provided to you for that. And for more details and to stay updated, please visit our website and our Instagram.